So being community-based, and especially with having the community families all in the same area, they tend to get to know each other, or they get to know each other through our programs, or that everybody figures out they have me as a nurse, or they have all the same neurologist or whatever it is. So families do tend to know each other more than we realize. And I think it can be really tricky for us, especially if a kid has a decline, but more so when there is a death in the community. And we see it sort of manifest in every single way. And we do talk about it. We bring it up at our team meeting, like so-and-so's death is going to affect, from what we know, these families. And, everybody with this diagnosis that's going to have heard about it. I mean, sometimes families that have nothing to do, don't know the family, or they live 10 towns over, end up being like, so did you pronounce so-and-so? And I'm like, So we do tell them that we can't disclose information because that's HIPAA, and we try to protect the other families, and I would never do that without permission. A lot of times I use it as a way to sort of prompt having conversations of, what would you do? Or is this something you worry about? And it's more of is this something you worry about? So, okay, so you heard that this other child, I pretend like I don't know them, generally I do, passed away and had this as a diagnosis. Like, what is this something you worry about with your kid? And then it can sort of open the door to a conversation. Or we do have some parents, especially ones who have known me better, been like, I know you know this kid and I know you can't talk about it, but I need to talk about how it makes me feel. And I'm like, great, that's a good way to do it. Tell me what's going on. Have you been sleeping? Generally, no, they're not sleeping, because a lot of parents have a fear of waking up and finding their child deceased. And so, especially if it's more of a disorder where that's they're at higher risk for that, and then a child dies, parents generally project what their fear is onto how the other child has passed. And so I can't really say, did they just wake up and the child was gone? The parents will ask me that, and I can't really give them any information. And so I say, I would guess it was probably just disease progression, but why are you asking me that? What's going through your head? And so I try to flip it back to the parent. And sometimes the parent is just generally sad for the other parent, and they don't need to have a goals of care conversation because we've had one or we're stable. They're just like, this is a sad thing that we have to go through in our community. And I just try to support them through that, because it is, and it's a reality. And a lot of parents will say, like, I hate that this is a reality in our community, but it is. And parents will ask a lot of times how they can be helpful. And so we make suggestions as like sort of generic, and sometimes if I can subtly fine tune them to the family, I do. But, whether it's just, if you know them, reaching out like normal and offering things. Or one thing that I do try to say to parents a lot is they're going to have a lot of support until the funeral, and then everything's going to dwindle down, because that just seems to be the trend, unfortunately, no matter who the loved one is, whether it's a child or a grandparent. That seems to be how it goes. And so I'll say, like, 2 weeks after the funeral, that's when you can do your outpouring of support, and it'll mean a lot. And parents like to have a task, and so that seems to be comforting to them. A lot of times a pediatric death in the community will also prompt, how did it happen? Can that happen to my kid? Or what things will make my child pass? Or how do you see their decline going? Not very many parents want to go there, but sometimes they'll hint around it, and then I ask, are you asking me how I think your child is going to decline? And then they're like, yeah. And that's when I give the warning shot and so say, okay, I'm going to be honest with you, but if it's too much, just stop me, because I'm not really worried about it right now. I'll let you know when I'm worried about it, but I'm not worried about it right now. And then we can have that conversation.